think we're just waiting for 2 more students. 3. So how is everybody doing for week 2? Did everybody get organized from last week with all your classes, and did you get a schedule together of all your due dates and assignments and for all your classes?
Yeah, we're ready.
Ready to roll. Okay. Does anybody have any questions from week 1 from the orientation? Some of you have emailed me questions, which is great. I appreciate that. Appreciate that proactive communication. So I think today we'll start by doing the quiz, and then I have just a few housekeeping items, and then we'll review the quiz and do some what you're going to see in the quiz. If you get the question right or wrong, there's going to be a rationale, and we'll work through that when we review the quiz. Hopefully, it'll be helpful to you.
Professor Marvel,
Yeah.
my friend Mandira is in a waiting room.
Okay, I don't have anybody in the waiting room yet. But thank you for letting me know. I'll watch for her.
You're welcome.
She has
Do
some
we need a whiteboard?
No.
Oh, okay.
Hey, I still don't see her. Let me give it one more minute.
Yeah, she just sent me a screenshot of her saying she's in a waiting room for your
Yeah.
class.
Yeah, I don't have anybody. Make sure she's in the right waiting room in my class, because there's nobody in the waiting room.
Yeah, I just say your class. I don't know where she went.
Make sure she's in the right class. Okay, I think we'll go ahead and get started. So everybody refresh their quiz. I want to make sure you can see it. Can you see it? Okay. There is an access code. It is my last name. I'm going to put this in the chat. So the quiz is 15 minutes timed. You've got to stay on camera for the quiz. Once you're done the quiz, don't log out. You can go off camera, but let's see. It is be about 3:05 when we start. So we'll start back at 3:20. How's that? Okay. Everybody see my last name in the chat. So go ahead and get started on your quiz. If you have any questions, I'm going to mute myself. If you have any questions, put them in the chat. Okay? Looks like everybody's done. Guys could all come back on camera. How'd you do?
Pretty good.
Okay.
Not that good.
Did everybody complete the two content recordings for weeks 1 and 2? All the readings from weeks 1 and 2, and had a look at the PowerPoints. Everybody do that? So if you did
Not
all
part of
that,
it.
what?
I didn't do all of it, no.
Okay, so if you did all that, you should do okay in the quiz. Well, when I developed the quiz, I think I told you in week 1, when I develop my quizzes, I develop them from those resources, right? So your recordings, your PowerPoint, and your readings.
If that's the case on the reading, and I'm not mistaken, one of the recordings, the first question when it says which example of community-oriented nursing practices,
Mhm.
why would it in one of your previous recording it said educating a child and school teacher on the use of an inhaler.
Okay, we're gonna
But
go
on
through the
paper, it's saying
questions.
it's wrong.
We're gonna go through the questions. Okay? I'm gonna go through the questions now. Did you all see the rationales?
Yeah, I see the rationales, but after
Yeah.
listening to your recordings and reading,
Mhm.
the answer would have been educating a child and school teacher on the use of an inhaler, but it says it's wrong.
No,
that's
that
community
wasn't the
oriented
answer.
nursing
Hang on, Claudia, we're gonna go through the quiz now, okay? So stop me when we get to that question, okay? All right. Gonna share my screen. Can everybody see my screen?
Yeah,
Okay. All right, my first question is, how did you like the rationales?
I like them.
I
Yeah.
like them.
Yes, they're helpful.
I like them.
Yeah. And of course, it's the same rationale, whether you got the question, if you got it correct, I wanted to provide you a rationale. And if you got it incorrect, I want to provide you a rationale. So they're the same. Okay. So let's start by number 1. And so these questions, I tried to do a variety of questions covering most of the concepts from weeks 1 and 2. So let's first talk about, first question would cover the concept of community-oriented nursing. Okay, so let's go through the question first. Well, let's take a step back. What is the difference between community-oriented nursing and community-based nursing?
So community oriented means the whole community.
Mm-hmm.
Community based means an individual, like, teaching with a person or a family or at home, things like
Exactly.
that.
Okay. Okay. So the correct answer would be number C, right? Evaluating the outcomes of a community vaccination program, because you're looking at the whole community, right? We know that A, illness of individuals and illness care of individuals in the community is an example of community-based nursing. Educating the child and school teacher on the use of inhaler is community-based nursing because you're based in the community. Okay. And then home health delivery delivered in the community. That's all community-based nursing. So let's look at the rationale here. The way I remember community-oriented from versus community-based is when you think about community orienting, you, like Cherie said, you are orienting yourself to the whole community. Okay? You're looking at the community as a whole. When you're practicing community-based nursing, you are based in the community. So in this particular answer, or B in this question, educating the child and school teacher on the use of inhaler. That is a school nurse, right? So she is based in the community in a school. Okay. D, the home health care is delivered in the community. That is a home health nurse based in the community, taking care of clients in the community.
And see, I put C, but at first I was gonna put D, but then I remember you said it's not just home health. Then I was gonna put A, but then I felt like that was too particular. Then I was like, okay, maybe C make the most sense, really.
Right. Well, community, I'm looking at the rationale now. Community-oriented nursing is oriented around, like Cherise said, the entire community, the whole population, right? Primarily focused on health promotion rather than illness care, right? The big difference is it's focused on the whole group rather than individuals. Where community-based nursing is in a specific setting, right? Where you're providing care to the ill, the sick individuals, where they live, where they work, where they attend school. Okay, the emphasis on community-based is acute and chronic care. Okay. Any questions on that? Does that answer your question, Keandra? No.
Oh
Who
no,
ha-
I got it. I just was saying how
Okay.
I thought it out.
Okay.
So
Does
I have a
anybody
quick-
have any questions on question one? That we
I-
need more clarification on community-oriented versus community-based?
I do real quick.
So
Go ahead.
basically,
Make
when
sure
you
that I have.
you-
Hang on,
enough
hang on,
understanding.
hang on, one at a time. Let me stop sharing here. Okay, go ahead. Who's speaking? right.
Adriana.
Adriana, you
Uh,
go first.
So just to make sure I have an understanding of it, community oriented is essentially looking from the outside at a whole community.
You're looking at the community as a population, yes.
Okay, and then community based is like you're already based in, like this is your community and you're looking how to help it.
Correct, correct.
Thank you.
You're welcome. Rebecca, go ahead.
she just said it, I was gonna say the same thing. When it
Okay.
says community oriented, you focusing on the whole, not just one.
Right, right.
Okay.
And that's what was in your rationale,
Mm-hmm.
right? This last sentence on community oriented, primarily focused on the health promotion rather than illness care, the whole group versus the individual. Okay. Question number 2, this revolves around the second concept, one of the concepts from week 1, which is Healthy People 2030. How many of you had the opportunity to look at the Healthy People 2030 website? And what did you think of it? Pretty amazing, isn't it?
Yeah, it had all the answers.
Yeah. But I mean,
Yeah.
overall, did you enjoy perusing through the website?
Yeah.
Really is a very educational, informative website. So, which describes the purpose of Healthy People 2030. This was all on the website. So we have the 3 correct answers, right? It provides a framework to improve the health of all Americans, right? It's a national model. Attain healthy, thriving lives and well-being free of preventable diseases, disability, injury, and premature death. Promotes healthy development, healthy behaviors across all life stages. Okay. So our rationale, well, let's go back to the wrong answers. It is not a standardized nursing curriculum. And if you looked at the website, you would have found that it is definitely has nothing to do with nursing curriculum. Okay. So what it is, it's national. We actually it's Healthy People 2020 started back in 2000. We had in the 90s, actually, we had Healthy People 2000, then we had Healthy People 2010, and Healthy People 2020, and now we're at 2030. Okay, so they are national objectives to improve the health and well-being over the next decade. Okay. So achieving these broad and ambitious goals requires setting or working towards achieving a wide variety of goals. All right. And then the rationale lists out the 5 overarching goals. And the common theme is it's trying to cover everybody. Okay, it's not individually based. It's national standards. Okay. Anybody have any questions about that? Okay, primaries. Have you worked through primary, secondary, and tertiary interventions in any of your other classes?
Yes.
Great. So you know what these are.
Mm-hmm.
Okay. So let's review. What is primary?
It's preventing
It's
something.
preventing,
Prevention. What is secondary?
It's screening.
screening,
Screening. What is tertiary?
Treatment.
treatment,
Treatment. It's a simple way to remember it. P for primary is prevention. S for secondary is screening. T for tertiary is treatment. Okay. So the obvious answer to question 3, what's an example of primary? So we're trying to prevent something before it even occurs, right?
Mhm.
What is B?
B is secondary,
Correct. And that word screening gives it away, right? What is C?
Tertiary.
tertiary,
Tertiary. Management of a disease, so they already have something, right? And then what is D?
screening,
Yeah. Part of
secondary.
part of what you're doing when you're screening is that you're trying to identify risk early and provide early intervention so that hopefully it doesn't transition into tertiary, right?
Mhm.
And I think this rationale gives a nice summary of each one. Okay. And remember, when you're studying for exams, you can always go back and look at the quizzes. That was another reason I wanted to put rationales in, because you can always go back to your rationales and look at them. Right?
Mhm.
Okay. Number 4, another concept that was covered, that we cover in week 1, is introduction to vulnerability. Okay. So which client is not considered? I'm not sure who got this right and who got this wrong yet, but did you?
23-year-old is
Mhm.
not, because the other 3 are vulnerable populations.
Correct. And maybe if you got it wrong, I'm not sure if you picked up the word not. Right. So this is, I like to do exam prep, exam strategy preparing as well. One of the really important things about reading, whether it's quiz question, exam questions, is reading the questions slowly and pulling out those key words, right? This is a negatively framed question. We have positive questions and we have negative questions. This is a negatively framed question. It's asking what is not considered. Did anybody miss the word not? So Charisse is right. All these other answers are considered vulnerable populations. What are some other vulnerable populations? Where'd you learn from your readings?
People with mental illness,
Mental illness. What else?
Chronically ill.
Chronically ill. What
the
else?
elderly,
Elderly,
Homelessness.
homeless,
Children,
Never mind.
kids.
Mentally disabled.
Pardon me?
Mentally disabled.
yeah, we said them.
Right.
Non-speaking English.
Oh.
and
Exactly. Non-speaking English. Yep, exactly.
drug users.
Yeah. Substance abuse, drug use. Yeah. Great. So vulnerability, what is it? Right? We know, I'm just reading through one of this rationale. Susceptible to actual or potential stressors that may lead to adverse effects. Think of all the populations we just mentioned. Right? Vulnerability to poor health doesn't necessarily mean that some people have personal deficiency. Right? It results from the interacting effects of many internal and external factors which people have little or no control over. So, for example, a person may have some biological limitations due to generic risks, right? Made more severe by maybe environmental risks, where you live, right? So overall, vulnerable populations are those groups which have an increased risk for developing adverse health outcomes. So think about it. Think about another vulnerable population we didn't mention is individuals, families, communities that live in poverty. Makes them much more vulnerable, correct? Vulnerable to a lot of things, maybe lack of access to healthcare, lack of access to education, lack of access to proper nutrition. Right? So vulnerability creates numerous risks. Okay? Maybe it's your clients that have severe mental illness or substance or drug issues, and there aren't enough resources, or there aren't any resources to help these people in your communities. I mean, think about it. Think about where you live. Think about the zip code you live in. Does your community have all the resources to support these vulnerable populations? You know, they may have a lot of resources, but probably not all the resources these vulnerable people need. Which of the following is considered nursing interventions in caring for vulnerable populations? By the way, on your quizzes, you do get credit for correct answers on the select all that apply. Okay, it's just not a 1 or 0. If you got 2, it's a 0.67 or whatever. So which of the following considered nursing interventions in caring for vulnerable populations? Well, all 4 are actually correct. Here's another teaching strategy. Don't be afraid to select all on a select all that apply. Okay? There may be quiz questions and exam questions that everyone is correct. So don't feel like you have to not select one because there's no way everything could be right. Sure there is. Okay, so what are we going to do for vulnerable populations? We're certainly going to try and increase the resources, right? Provide comprehensive services where people live and work. That's what I did as a school nurse. Provided lots and lots of resources for whether it be parents, teachers, administrators, students. Okay, resources, maybe schools a resource, churches as a resource, issues in the neighbor or resources within the neighborhood, and in the workplaces. One of the other things we're going to do is we're obviously going to try and reduce our health risks, right? We're going to reduce our health risk. We're trying to reduce health risks by providing multiple services in one place or during a single clinic visit. What's an example of that? What are some venues or places that you can provide multiple services in one place?
Actually, well, I don't know.
Churches, maybe?
Where?
Maybe you could do it at a church.
It'd be a health fair,
Yeah, I was gonna say like
maybe
a
maybe a
clinic.
maybe a school-based clinic. We used to have school-based clinics in some of our high schools that was a one-stop for everything. Right? We used to have scheduled days where elementary school kids could come to get their immunizations, get their yearly checkup, get their, height, weight, scoliosis screening, vision, hearing
Like the
screening.
well, I know our health department in Florida, you can get your shots, get your birth certificate, death certificate,
Yeah.
everything.
Yeah. We as nurses will also assess the amount of stress for the individual and the family. Why is that important?
Because it
Remember
can
these.
lead to physical ailments like high blood pressure, heart disease.
We can assess maybe their financial well-being, right?
Mhm.
What's causing the stress? What are the stressors? Maybe they have transportation issues. Maybe they have financial issues. Maybe they have English as second language issues, right? Maybe they have lots of things. But the point is, we do need to assess the amount of stress for the individual or family, try and get them some resources that they need. And then obviously, another intervention is trying to reduce health disparities, right? People who live in communities with lots of environmental risks have a more likelihood to have negative outcomes, especially the vulnerable populations. So assessing their living environment and neighborhood surroundings. We'll talk about this when we get to our environmental health, I think in week 6 or 7. And we have a whole section on environmental health. I mean, do we live near rivers, streams, water that there's potential water contamination? Do you live near transportation hubs where there's potentially air pollution? We live on contaminated soil. Do we live in an industrial area? Do we live near a waste site? Do we live in a filthy neighborhood where it's littered with trash and there's just lots of risks, right? So individuals, families that live in communities that have lots of environmental risks, we need to assess that and be mindful of that. Okay, so vulnerability has many aspects. It often comes from a feeling of lack of power, limited control, victimization, and a disadvantaged status, also disenfranchisement and health risks, right? Members of vulnerable populations often have multiple illnesses, with each affecting the other, right? So some of the people that do not succumb to the health risks, it's important to help them develop resilience, and that's what the next question's about. Okay. Nursing intervention. Sorry, I have a thunderstorm going on, so if you can hear the thunder behind me, I apologize. Nursing intervention should include strategies that will increase resources or to try and reduce health risks, to try and decrease these health disparities between vulnerable populations and not vulnerable populations, right? So one of the things that we work with our vulnerable populations is to try and increase resiliency. What is resilient? What's resiliency?
It's the ability to bounce back
Yeah.
from, yeah.
What else? What else is resiliency?
It's like a learned behavior. Like if you had something, you learn how to fight it next time, kind of.
Cope better. Yeah.
Yeah, coach.
Yeah. Well, you're gonna find, you may have already found this in your work settings, working with vulnerable populations, because it doesn't matter where we work, what area of nursing we're in, we're always going to be working with vulnerable populations, right? Whether it's acute care setting, rehab centers, long-term care facilities, urgent care, schools, workplaces, there's always going to be vulnerable populations. One of the most important things we can do as nurses is help these vulnerable populations try and increase their resiliency. Okay, so in this question, which statement reflects resiliency? Answer is B. Having resiliency reduces our vulnerability to certain risks. Okay, let's read about resiliency and our rationale. Resiliency is influenced by early life experiences. Negative events during childhood that aren't dealt with through counseling and other approaches can decrease resiliency. I saw this all the time in the schools with these kids, all the way from preschool to high school. Higher levels of confidence in one's ability increases your resiliency. especially with kids and adolescents, right? Helping to protect them from negative effects of trauma or disaster. That's why that mental health, so I'm speaking from my experience in the schools. That's why that mental health, that counseling support to these kids, once we identify their risks, is so critical. Right? When you don't feel like you have any control over your circumstances, that does impact your decisions. Okay, people, individuals, families with low resilience have a very difficult time taking action, seeking care for their health problems, engaging in preventative activity, right? We know the vulnerability, just like your answer, this is your answer, vulnerability can reduce or be reversed by increasing your resilience. Right? Some of the nursing interventions to increase our resilience that with our clients is helping them find resources that can support whatever stressors they have going on. Health education, helping them coordinate their care. And certainly policy making at the state level related to improving health for vulnerable populations, trying to decrease those health disparities. Right? I wanted to review, I don't think I have a quiz question about social determinants of health, so take some notes here. So this is social determinant, how do we determine the health of an individual? Remember I said in week 1, in the community, our clients can be individuals, families, groups within the population, the elderly, the kids, the mental health, the people with mental health issues, the people with addiction issues. Okay, so social, it's a fancy word, social determinants of health. Okay, these are how we determine, how do we determine the health of an individual, the health of a family, the health of a community, by looking at the social determinants of health. Okay, it's some examples. Do people have safe housing, safe transportation? Are their neighborhoods safe? In their communities or schools, is there racism that exists, discrimination, violence? What's the education opportunities? Do the kids have good education opportunities? In the community, are there good job opportunities to earn income? Is there a high unemployment rate, low unemployment rate? What about access to nutritious foods, access to physical activities, after school programs, parks, recs, walking trails? We talked about polluted air and water. These are all the things that determine the health of a community. And then language and literacy skills. So if you take a look at all of those social determinants, right? Education, environmental issues, language, employment, housing, transportation. If you have a community that doesn't have a lot of that, you're going to have a very vulnerable community, right? And in community nursing, those are the clients we're taking care of, right? Okay, this focuses on functions of the family. Let me jump here to my, okay, so, okay. What is a family? What's a family? This is aside from, I'm doing my lecture in between these quizzes. So what's a family?
It's a group of people, I would say, in the same living quarters. I don't know.
So it can be blended, it could be um step family,
Yep.
I forgot the other one is, yeah. Or
Is it-
what's partner?
Is there really a definition of what a family is anymore? Is there a hardcore definition?
No, it's
No,
Not really.
no, no. And that's okay,
Family is
right?
anyone you live with that you consider family.
Exactly. Whatever they say it is, whatever they
Mhm.
say their family is their family, right? It's usually people who provide physical, emotional, financial support, right? Non-traditional families are the norm, are they not? Okay. When we look at families, is our community assessment. We try and look at healthy or functional families versus unhealthy, dysfunctional families. Okay, so there's 5 areas we look at, and it's right below. We'll get back to the question. Okay, but there's 5 functions of a family. So you are the community nurse, you're doing a family assessment. You go out and do home visits. Okay, and you're doing a family assessment. Here's the 5 functions of every family. Okay, financial. Are they planning for the future? Are they making good financial decisions? Are they providing housing, shelter for their family? Health. Are they teaching healthy behaviors, health maintenance behaviors? Informal caregiving, reproductive, perpetuation of the species. What does their reproductive activity look like? Do they have children that they can support? Do they have too many children and they go into poverty? Okay, what is the function of the reproductive aspect of the family? Socialization. Are we raising children to be fit into to fit into society, to become productive, responsible, well-adjusted adults? Are we passing on spiritual, religious, cultural beliefs? And the last function is affective, right? Are we trying to create a sense of identity, belonging through affection, love, spending time together, bonding? Okay, so when you look at these 5 functions, obviously the question, which is not another negatively framed question, which is not considered one of the 5 functions, education. Okay. So this is how we measure, how we assess how the family's functioning. All these 5 are present with every family. Is it positive or is it negative? And that's how we do our assessment of what's a functional versus dysfunctional family, healthy family versus unhealthy family. So failure to meet these functions will typically lead to problems, dysfunctions, strife, and crises within families. Right? Maybe there's a family member that has a substance abuse issue. Maybe there's a family member that suffers from anxiety, depression. Maybe there's a family member that's unemployed. Maybe there's been a divorce. Maybe there's been a death in the family. Right? Lots of things can contribute to a healthy versus unhealthy family. You know, the family is our first and most important safety net and social support system. Typically, they're our primary coping mechanism. Okay. Does anybody have any questions about the functions of a family?
Yeah, so
Go ahead.
I know educator wasn't the answer, but why would that not be part of the family function?
That's not listed as one of the 5 family functions. This is a common list we use for the 5 functions of the family.
No, I'm saying like, I know that, but I'm saying why wouldn't they consider? Because you would think like with the family, like the parents would be like an educator to the child, you know?
Yeah, I mean, we could probably put education in one of these categories, right? I mean, if parents are, again, I'm just trying to place it there somewhere. If parents are, I don't know, educated, and then maybe they're raising their children to fit into society, become productive, responsible adults. Maybe without a lot of education, you're not able to do that.
True.
Maybe they
Sharice?
don't have kids either. It could be a family that doesn't have kids and it's just a husband and a wife too. So I guess that's why they didn't put education there, because I guess they figured it could be a different kind of family.
Yeah. Thank you, Sharice. Okay, here's a school nurse question. Okay, school is practicing a tertiary intervention in the school clinic. What is she doing?
Yep, administering medication.
Right. And we're administering medication because somebody has something going on. Right? So it's tertiary. What's B?
Secondary.
It's preventive. It's
Right.
Yeah.
We're teaching, B is
Primary.
primary. We're teaching preschoolers
Primary.
about good hand hygiene. So we're trying to prevent them from spreading stuff. Right? What's C?
Secondary.
secondary.
Yep. What's D?
Secondary.
Okay, great. And then in this rationale, I give you some examples of primary, secondary, and tertiary. Right? Primary has a lot to do with education, preventing childhood injuries. Maybe we're doing prevention teaching with seatbelts, helmets, playground safety. Secondary screening. Kids coming into the clinic, we're screening them for headaches, stomach aches, fever, sore throat, whatever. Right? And then tertiary is obviously medication. Right? They've got something going on that we're giving the medication for. Okay, what should be considered an appropriate intervention for a student with ADHD? I see, I didn't even read the word not. See, I read the question too fast. Which would not be considered an appropriate intervention with a student with ADHD?
I had to read that over
101
again.
aid.
Right.
Yeah, especially when you look at number 3, you don't know if they're saying limit it or don't limit it. Yeah,
Don't read too much into it. Don't add,
right.
here's another tip. Don't add information into questions, guys, even with quizzes and exams. If the information is not in the question, it doesn't exist. Okay, that's a good rule of thumb. Don't, for all you overthinkers, don't be adding in what if? Well, what if this is going on? Don't. All the information you need to select the answers in the question. So which would not be considered? Everybody understand why assign an aide to work with a student? Maybe some students might need an aide to work with them, right? But not all students need that. So it's not really an appropriate intervention for a student because you're making the assumption that all students need to be assigned an aide, one-to-one, right? Place a child in front of the classroom, that's a good intervention.
I put-
Give clear, short directions and repeat them often, that's a great intervention. Do not limit outdoor physical activity as a punishment, that's a good intervention. But having to, just assuming we have to assign one-on-one, we don't make that assumption. Or some might, but we don't make this, that's not a general rule. Okay, and then here's a little rationale right from your book about ADHD. Okay. Next question, last question is about acute conjunctivitis. And it's asking what's true. So if you read your section in your book about conjunctivitis, you would have selected A, C, and D.
Yep.
All right. Okay, any questions about that? Let's see what we haven't covered. I'm bringing up our PowerPoints, okay? So this was from week 1. Here was our concepts. I think we've covered all this. We talked about community-oriented nursing, community-based nursing. Public health is used, so now it's very similar to community-oriented nursing. Okay, a lot of times community nursing, public health, and health nursing are used to mean the same thing, where we're looking, think of what public health nurses do. They're looking at the whole community, right? We went through levels of prevention. Does anybody have any questions about that? Healthy people we went through. And here were the 5 goals. I think I just copy and pasted this right into the rationale. We identified these groups. Identified all of them. Right? We talked about vulnerability. Epidemiological triangle. I don't know that I want to address that today. We're going to talk about that when we get to infection control. The well, actually, I take that back. Epidemiological triangle. What did you learn about that in your readings? Okay, it's a triangle. It needs 3 pieces. Go ahead, Sharice.
The agent, the host, I forgot the last one. But
Somebody help Sharice.
The environment, the
yeah,
environment.
Right.
and it
So
takes all 3.
Takes all 3. And it can be a combination of all 3. It has to be a combination of all 3. The agent, I'm going to take COVID. Okay. COVID, for example, is your agent. It's whatever virus, bacteria, chemical exposure. So agent, you have to have something. So you have to have the flu. You have to have COVID. You have to have been exposed to a chemical. That's the agent. The host is us. Okay, we're the ones who get sick. Maybe. Okay. And the environment is what in the environment has contributed to how sick we will get. So think about the host, us. Are we healthy? Are we not healthy? Have we been vaccinated or not? What's our age? Are we young? Are we old? Are we immunocompromised? Do we have unhealthy lifestyle that makes us more vulnerable? Okay, so let's take COVID. Okay, so COVID's the agent. The host is the host is the elderly. The host is a group of elderly in a long-term care facility. Okay, just the simple environment puts them more at risk. Right? What if some of them are vaccinated? Okay, maybe some become less at risk. Okay, so the environment makes a big difference. Are you a healthy high schooler playing on a football team versus an elderly person in an assisted living? You're going to be much more susceptible to getting sicker. So sometimes your sex can make a difference. Your age can make a difference. Your location, your environment, your health. And what if it's a bad strain of the flu and you haven't been vaccinated or vaccinated? So does that make sense? So a combination of all 3 will help determine how this all plays out. There were significant vulnerable population groups that got much sicker, and there was much higher morbidity and mortality with COVID. Right? Okay, we talked about resilience, disenfranchised, we talked about poverty. We are going to be talking about these groups in week 2. This is week 1, right? Yeah. These are all the groups we're going to be talking about in week 2. Well, actually, we're kind of covering that. We covered the poor, homeless, pregnant teens, veterans, migrant workers, immigrants, mentally ill, and substance abusers. Here's your 5 domains. Or, excuse me, your social determinants of health that we talked about. This helps determine the health of an individual, a group, a community. Economic stability, education access, healthcare access. What's your neighborhood like? What's your community like? Does it have a lot of resources? Okay, so looking at these 5 domains that can really help determine the health of your community. Okay. And week 2. School nurse, growth and development, childhood ailments, which is what your discussion question is about as well. we talked a little bit about family nursing and family health risks. Okay, our class activity here in a few minutes, we're going to break out into some groups that I have some questions for you. You're going to look up. It talks about the school nurse. What does the school nurse do? School nurse has multiple roles. Okay, maybe they're a direct caregiver. You know, for me, in my role as a school nurse for 20 plus years, I was a direct caregiver. I was cathing students, both male and female. I was doing tube feedings. I was giving insulin shots, trach care. So one of the roles could be a direct caregiver. I also did a lot of health education. I was a consultant to the staff, to the administrators. Case manager, managed very complex kids in the schools, working with mental health, speech therapy, OT, PT, doctors, therapists, and did a lot of community outreach. Okay, resources for families, conducted health fairs, conducted immunization clinics. School nurse has lots and lots of different roles. All right, here's some examples of school nurse with what we're doing with primary, secondary, and tertiary. All right, we talked a little bit about this in one of the rationales. Growth and development, infancy through adolescence. Okay, here's how we break out the different stages: prenatal, infancy, early childhood, middle and late childhood, and adolescence. Okay, and as you read through your growth and development, really for community nursing, what's important to know is what are the stages and what are the risks? What are the big risks during these stages? You know, we talk about adolescents, we talk about seatbelt safety. These are kids that might be getting their licenses. Okay, maybe middle-aged kids, risk of falling off their bikes. We talk about seatbelt safety. Okay. Common childhood ailments, all of your readings. I sent out an announcement earlier today. The pages were off by like 2 pages. But I'm sure you found them, right? You found all your readings, right? So, but I put in the exact, I had the readings from the 8th edition book, and you guys are using the 9th edition. Okay. So we went through all the, well, you went through all the common childhood ailments. Okay. Adulthood in the family. Obviously, adulthood is a time of continuing change and growth. Young adulthood is considered ages 18 to 35. Middle, 35 to 65. Older starts at 65. Right? So we know that a person's lifestyle, diet, exercise, stress management has a major influence on health, right? Heredity can also contribute. Maybe you are predisposed to something physically, psychologically, maybe substance abuse, maybe alcoholism, heart disease, cancer. Okay. A lot of what we do in community nursing is health promotion, community-oriented nursing. We do health promotion, right? Trying to help adults practice good health. Okay, we talked about family nursing, how the family is defined, functions of the family. We talked about that. Family health risks. Remember, genetic. We just talked about born with certain predispositions. Okay, environmental health risks. I'm looking at my notes here. Okay, what if you live in a neighborhood has a lot of poverty? We already addressed this. Neighborhood that has a high crime rate. Neighborhood that has a low graduation rate. Neighborhood that doesn't have a lot of social resources for people, doesn't have after-school programs, parks, recs, right? What about neighborhoods that have high populations of non-English speaking? Okay, and then the other health risk for a family is behavioral. This simply means these are your choices. Behavioral are your choices. Do you choose not to be healthy by not exercising, not eating right, right? Do you have, do you not think that preventative care is important, or primary care is important, or screenings are important? Behavioral means choices. Okay, and when you make unhealthy choices, there will be risks associated with that, right? So questions about the content. I really like the rationales because I like teaching from the rationales, because I try and slide in a question from every concept, and then we can talk about it. So here's what I'm going to do. So we have an activity. I'm going to break you out. I don't know how many people we have, 60. I'm going to break you out into groups of 3. You're going to go into a breakout room. I'm going to post, actually, I'm going to put up on our screen. Here's what we're going to do. And because I was in school nursing, my activity has to do with school nursing. Okay, so I'm gonna share my screen here. That's what we're gonna be doing. Okay, I'm gonna put you in breakout rooms. Room 1, room 2, 3, 4, 5, and I will leave this up. Okay. Actually, what I'll probably do is copy and paste it. Why can't I copy and paste it and put it in the chat? The 3 of you are gonna go investigate this for about 10 minutes. Okay. And then we're going to go back and talk about this. I want you guys to be experts on school nurses. Okay. Can I put this in the chat? Let's see if this works. Oh, it does. Can you guys, oh, I didn't post it yet. Can you guys see that?
Yes.
Okay, fantastic. Okay. Does anybody have any questions on the concepts?
No, are you gonna like further explain what we're gonna do with those titles?
You're gonna do a research. You're gonna go do a little bit of research here.
Okay.
Let's see. Yeah, you're gonna go in and do a research. You're gonna go in and do a little bit of research. Okay, so I'm gonna assign you all a breakout room. The question you have to answer, whether you can go back to your readings. Okay, you can it's in your readings. So I want each group to answer these questions, and I'll check in with you guys after I assign you. Okay? So when I open the rooms, you all go into your room. Oh, oh, wait, where's my room 5? Yeah, I didn't know there it is. Okay. All right, so go into your rooms and start talking about all of these, and then we're going to go back and talk about the school nurse. Mandira, did you get into a room? You need to go ahead and join room 4. Can you hear me? Mandira, can you hear me?
Hello.
Yes, hi. You should have an invitation to room
Hi,
4.
I have internet issue. I haven't received it yet.
Let's see. Yep, you have an invitation. Let's see. It says you haven't joined yet.
Okay, there you go.
Okay. Guys working on it?
Yeah, so we have the education requirements for what it takes to be a school nurse.
Yeah, you're in room 1.
Uh-huh.
Yep.
Do you want us to do it?
No,
Because I know
just
we're probably from different states. Does it matter what state it's
no,
from?
no.
Okay.
Just generic requirements.
Okay,
Okay?
cool.
Thanks.
Okay, so the difference I'm seeing from what I'm reading is like with the elementary, the school
Mhm.
nurse is basically helping them develop good hygiene practices, self-awareness in their health. Um,
You checking out educational requirements?
yes.
Okay, good. All righty.
Mhm.
How you guys coming?
We did pretty good.
Doing all right?
Yeah.
There's Mandara. Okay, she finally get in there.
Hello.
Okay. Hello.
School, there we go. I found it. A school nurse can help
Mhm.
students and their family get access to health insurance.
Did I give you enough time?
Yeah, kind of.
Communicates.
Okay, let's wait till everybody come back. I'm a little bit biased on school nursing. It's such a big role now.
Why?
Why is it a big role?
No,
if-
why are you biased?
Oh, because I was a school nurse for 22 years.
Okay.
When I was growing up, we all went to the school nurse clinic for Band-Aids and a hug, right?
Mm-hmm.
That's what the nurse used to do.
Well, now, before I started the nursing program, I was working at an elementary school, and we couldn't even put a Band-Aid on the kids. You can't do any type of care for them unless their parents sign a paper giving you authority to even put a Band-Aid on them. So school nursing is not what it used to be.
No, that is for sure. That is for sure. Yeah. Yeah. It was a very busy job, very busy job. And we weren't site-based. We were a consultant. We covered many different schools. So I could have up to 2 preschools, 2 elementary schools, a few middle schools thrown in there, and a couple of high schools. So I could start my day out teaching 3-year-olds how to do good hand washing and finish my day with talking about substance abuse, suicide prevention, risks of suicide with the high schoolers. Yeah. And everything in between. So everything in between. All right, let me share my screen. Okay. Start with room 1. Room 1, what are the education requirements for a school nurse?
So I got that it requires them to have, the individual has to have a BSN in nursing.
Mhm.
So a bachelor's with additional education leading to an Ohio Department, well, because I'm in Ohio, an Ohio Department of Education Pupil Services license.
Yep.
You can get a 1-year temporary one or a 5-year professional, or you can get they have like an additional program called the School Nurse Wellness Coordinator Endorsement Program, which is just a little further for like emergency services and kind of prepares you for other extensive issues.
Yeah. And the second thing, who was just that was speaking? Who was that?
Me, Adriana.
Adriana, great, thank you. The second thing Adriana was talking about was a state license. Not only do you have to have your nursing license, right, your BSN nursing license, but you also have to have a certification from the state education. Colorado is a CDE, the Colorado Department of Education. So what Adriana is talking about is the Ohio Department of Education. You actually had to have a certification and go through training, just like Adriana said. There's a lot to school nursing as far as educational requirements. We had to keep our CDE, our Department of Education credentials updated every 2 years. It was, I think, close to 30 or 40 CEUs, mandatory trainings. So it's one thing to have your nursing license, but you also have to be licensed under the Department of Education. I think it's special services license. That's what it was. Yeah. Okay, room 2. How are the requirements different for elementary, middle, and high school?
So for the elementary, it's more about hand hygiene practices, maybe giving their scheduled meds, dietary, more along with those lines, like you're supervising, but you're still assisting them. Where for middle school, you're monitoring the children, maybe give their own medicine, the safety of meds, you're educating them, you're screening them. maybe writing up documentations, that the parents may need, or maybe like for referrals if they notice something's going on, maybe. In high school, it's more emotional and maybe providing safe environment, mental support, substance abuse, risk about suicides or about sex. They're more of like a confident that they can go to and speak to that's non-biased. So they kind of maybe may get medication from them as well, like go to, give themselves their medicine there, but they're also there to assist them just in teaching and talking.
Yeah, that's a great assessment. In addition to what Brittany said about the elementary schoolers, what else would you think a school nurse might be doing with the elementary schoolers to the rest of the group? With the elementary schoolers?
But one of the things that we did that our school did with our elementary students was they can earn like so many points for so many steps that they got each 9 weeks. So it's kind of teaching them
what kinds of things did they earn points for?
So they earn points. If you got so many steps, you would earn a point. If you brought in a healthy snack, you earn a point.
Okay. Yeah,
Great. If you spend so many times outside doing certain activities, you would get points, and it would total up to different type of prizes that they could get. Just a bit build health awareness.
Well, and if you look in your growth and development chapter, one of the biggest risks for elementary school kids is falls. So a big teaching push in the elementary schools is helmet safety. The other thing we start teaching early in the elementary schools, and I'm just not talking in my school nurse role, because I actually am still a member of the National Association of School Nurses. And so for school nurses, that's the library for policies and procedures and suggestions and teaching and focuses. But I still belong to them. And it's wonderful. But in elementary school, one of the things we're teaching about, and this has gone on for a while, is bullying, harassment. Think about it. That starts in elementary school, right? Self-advocating, right? We didn't really encourage, Brittany brought up medication. In elementary schools, we're a bit hesitant for students to be taking their own medication. However, once they shift into middle school, let's say you have a diabetic, okay? And once they shift into middle school, we are really promoting that they are starting to learn to take care of themselves. That is giving their own insulin injections or insulin pens or whatever. So with regards to medication, I just want to clarify, we're a bit reluctant in elementary school. By middle school, we are really encouraging them to be able to use their own inhaler. If they need to give themselves an EpiPen, if they think they need an EpiPen, or at least carrying it.
I'm sorry, I meant that we give them the scheduled medications,
Yeah,
the nurses.
Yeah.
Not them per se, because they're elementary. I expect them to medicate themselves.
Yeah. Well, actually in high school with medications, they just bring whatever they want and slip it in their pocket. We don't even know what's going on in high schools. But elementary school, we typically will give them their medication as assigned in the clinic. Middle school, yes, we still give them their medication, but if they're oral pills, but as far as their inhaler, they'll typically keep their inhaler in the clinics, but when they come, we give it to them and they do their own. Right? So with regards to middle school, we're also continuing the discussion of harassment, bullying. We'll get into online harassment, bullying, right? Middle school is not too early to start the education on human abuse, human trafficking. They're hard subjects, but right? High school, Brittany nailed it. Drug abuse, say the risks, lifestyle risks, peer pressure. The other thing we're talking about in high schools is teen pregnancy, right? Okay, room 3.
Okay, well, I found that for here in Florida, they want you to have a bachelor's degree in nursing.
Mhm.
You gotta have your nursing license.
Mhm.
They said they want you to have 1 year of experience in school nursing or related, but if you're getting into school nursing, I would think that 1 year of maybe community nursing would
Mhm.
count as that year. And they said one of the a lot of the schools want you to have 1 to 2 years of clinical experience, so you couldn't just come right out of nursing school. They want you to have like clinic experience
Yep.
in that, and it's mandatory that clinicals be a part of the nursing program that you went to, which it's going to be anyway.
Mhm.
Yeah.
Yep. Anybody have anything to add to what Janet said? Excellent. Excellent. What about room 4? What are the school nurses' responsibilities these days?
So their responsibilities were to like manage acute and emergency and like chronic illnesses in the child. Like if a child had like asthma, the nurse would be responsible for like the making sure they take the asthma pump or like any insulin while they're at school.
Mhm.
And they're also responsible for like preventative care and promoting like resources for the students and children, like getting their flu shots and stuff like that at school.
Mhm. Mhm. Okay, what else? Everybody can add. What else do the nurses do?
Well, part of what you said, they teach safety, like safety on the playground, safety when you're practicing sports, riding your bike, and things like that.
You bring up a good point, playing sports. When you get to the middle and high school level, the nurse is working right alongside those sports, those trainers,
Mhm.
right?
Yeah.
Doing the training, the nurses are teaching CPR in the schools, right? We're working with the staff, we're working with the administrators to make sure they understand what's in their building. How many kids do you have with EpiPens? How many kids do you have with inhalers? How many kids do you have with oral medications? What do you do in an emergency? What meds do you have to take? How many diabetics do you have to take? How many diabetics do you have? How many
You need to
vials of
know-
insulin do you have in the school? How many bottles of Diastat? How many vials of Diastat do you have in the school with kids with seizures? What do you do in an emergency? Do you take it? Do you not take it? There's so many responsibilities. If you want to learn more about school nursing, I do suggest go on NASN, National Association for School Nurses. Okay, it talks about all the different responsibilities. And like we said in the slide, direct caregiver, health educator, trainer. You know, we trained all the staff to give EpiPens, inhalers, Diastat, how to care for a diabetic. So good. Yeah, lots of responsibilities. And you're really responsible for coordinating the care for the kids with complex chronic illnesses. And there's a
And-
lot of kids in the schools with complex chronic illnesses that have mobility issues, that are in wheelchairs, that are nonverbal, that need suctioning, that may need trachs replaced if they pull it out, that need G-tube feedings, need catheterizations. Lots. School nurses are very integral part of the healthcare, the school team. We were the go-to. And then when the pandemic hit, we went from a school nurse to a COVID nurse. I was there the 3 years for COVID. It was hard. It was hard. Happened overnight. So anyway, room 5.
Hi, we had room 5, and school nurses have various roles. They're direct caregiver, health educator, consultant, case manager, community outreach. A school nurse can help students and their family get access to health insurance. Coordinate care and care coordination in a school involves a school nurse organizing the care of students by sharing information and maintaining communication among those concerned with the need and care of student with chronic health condition, like you said, such as asthma, diabetes, epilepsy, and things like that.
Mhm. Awesome.
Yep.
What about vision hearing screening,
Oh, yeah. They also help
right?
with that.
We're also doing vision hearing screening of kids all the way from 3 to high school.
Mm-hmm.
Try to do some screening, early identification,
Right.
right? But just because kids pass screenings at 3, 4, and 5 doesn't mean they potentially develop a vision or hearing issue in first grade,
Mm-hmm.
right? So we're screening them. We're doing scoliosis screenings too, right? I'm looking at what tests the nurse performed, just thinking back. Do BMIs,
Yep, they do a lot
scoliosis,
of things.
what?
They do a lot of screenings for the students.
Oh yeah. Oh yeah. Vision hearing, BMIs, height and weight,
Mhm.
scoliosis. And the other thing we in the high schools, urine screenings,
Mhm.
right?
Yep.
Anything court ordered, we had to do in the schools.
Right.
There's a lot of education too with parents. I think back of all my newly diagnosed diabetics, whether
Mhm.
these kids are in preschool, elementary, middle, or high school, it's a shock. Okay, so my point is I worked with parents all the time, whether it was any kind of a new diagnosis, diabetes, epilepsy, maybe the kid fell over the weekend on the bike and now has a TBI,
Yep.
has a current concussion. You go through a whole concussion protocol now in schools. Okay, the parents are intimately involved with that. The teachers have to be intimately involved with that. The
Mhm.
kids with the TBIs or the injuries over the weekend. Okay, the
Yep.
kids that have accidents. I live in Colorado, so come back to kids that had ski accidents, that are in casts or tractions or traction or had surgery. They're on crutches, they're in wheelchairs. Okay, so a lot of education, especially, let's say there's a new mobility issue. You have to educate everybody. You have to educate all the teachers so the kid doesn't fall, right? Do you have access to elevators in your building that a wheelchair can get in and out of? Lots of things to think about. So what tests do nurses perform at school and what education does the school nurse provide? Whatever is required for whatever's required for the current situation.
Mhm.
It is up to us to make sure, all the way down from the administrator of the building, all the way down to the paraprofessionals, to make sure they have all the knowledge and training they need to recognize mobility issues, any kind of risk factors, abuse, neglect. We're responsible for the school nurse. We're responsible for doing all that training. It's a lot. It's a lot. So, in summary, I thoroughly enjoyed my 22 years in school nursing. When I think back of what I was doing in year 1 and what I was doing in year 22, night and day. And that's just our developing, changing society, right? Lots more chronic illnesses, lots more mental ailments. School is very inclusive. Everybody's in the classroom, whether they're in a special classroom requiring services or whether they're in gen ed, special ed, sped, or gen ed. You have to be ready for both. Right? You have to be a good communicator. You have to be very resourceful. Right? The local public health departments are wonderful resources. What do you do if you have a pandemic, COVID? What do you do if you have an outbreak of pertussis? What do you do with all the families that aren't immunized? I mean, it's a lot. I keep going and going and going. However, I loved it. I love being around kids all the way from preschool up to high school. Each group has its different challenges, but it was a very rewarding role. And school nurses are one of the most important parts of the puzzle. Everybody relies on you. Okay. Yeah, it's great. It really is. So thanks for participating. Thanks for playing and learning about school nursing. But yeah, it was awesome. Okay, so I'm trying to be mindful of time. Remember, we don't take a break, so we're done 10 minutes early. So I'm already 1 minute over. Does anybody have any questions that will benefit the whole group? And if not, I will stay on if anybody has any questions one-on-one. Okay? It's really good to see you guys. Happy week 2. Hopefully it's a bit more settled this week. Hopefully you learned a lot about the concepts from weeks 1 and 2. Remember, next week you'll have another quiz, but based on my announcement is only for week 3. We've covered 1 and 2. It's only week 3 next week. Okay? And remember, next week are exam reviews. Right? It's 3 exam reviews next week. You got the schedule on week 1. So look ahead. See if you can try and attend any of those. You'll get all the recordings once we do them. So you have 3 recordings. If you can try and get to 1 live or 2, try to. That's why I tried to give you the schedule early on if you could plan around work, school, kids, but I understand. Okay. So anyway, good to see everybody. Thanks for coming back for week 2. Appreciate it. And then starting next week, we start talking about some specific vulnerable populations, interesting material, migrants, rural populations, homeless. So everything that is all around us in our communities, right? If you're working in community nursing, you're going to be exposed to all these special vulnerable populations. So I look forward to next week. All right. So have a good rest of the week. Everybody reach out if you need anything. Okay. Bye.
I'm gonna stay on for a second.